Now to the outbreak of COVID-19 cases within the Yankees. Infielder Gleyber Torres now has tested positive, bringing the total number of cases to 8, despite all being vaccinated.
It's called breakthrough COVID, and a lot of people are wondering why and how could this happen. CBS 2's Dr. Max Gomez has some answers.
The first thing to know is that no vaccine is 100% effective. And while all 3 COVID vaccines have proven to be extremely effective at preventing serious disease, hospitalization, and especially death from the coronavirus, some breakthroughs can and have happened. There are so many possible variables that can contribute to a vaccine breakthrough. The individual's own immune system may not respond well enough. He or she may have been exposed to a COVID variant that wasn't fully prevented by the vaccine, or they may have tested positive before the vaccine had a chance to fully rev up immunity. That said, the chief clinical officer for the Yale New Haven Health System says you also have to understand how vaccines work.
They either prevent the virus from entering the body or put a stop to it once it begins replicating. So with all vaccines of the for COVID-19, it's possible that the virus can enter your cells, begin replicating, and then be stopped after they begin replicating, therefore presenting a period of time when you may test positive and may be asymptomatic.
In other words, test 3 times a day, as the Yankees do, and you're likely to find a positive test in someone who isn't sick. That's all but one of the positive Yankee coaches, and who may never get sick thanks to the vaccine. Not to mention that the shots dramatically reduce an infected person's ability to spread the virus to others. There have been a few thousand so-called breakthrough cases, but it's hard to tell how many of those got truly sick, and that's compared to nearly 120 million Americans fully vaccinated. Works out to less than 1,000th of 1%. Dr. Max Gomez, CBS 2 News.